interesting one today. Obviously, a lot of our Wednesday webinars are me talking about CQC and discussing CQC changes and quality statements and evidence categories and surveys and all this sort of stuff. This is taking a slightly different direction, but an absolutely critical one. We are exploring the concept of the National Care Service. This was inspired by a session that I went to a few weeks ago, essentially where there were some kind of care leaders having a little discussion about what this might mean, and it prompted me to do some deeper digging and to bring this through as an opportunity for a webinar. So, little welcome. Hello, if this is your first webinar, welcome. We started these up to keep people informed, keep on top of things around the care sector. We plan to do these every fortnight. We've got another one in 2 weeks' time on the 22nd of July it is, and I'll let you know what that's going to be about shortly, covering quite a wide range of topics, but typically it's in that kind of assessment, inspection, compliance space. So, let's talk National Care Service. Where did this idea of a National Care Service come from, and why should we start to take more note of it and be more actively involved in these discussions? The first thing to highlight is that the National Care Service is a Labour policy, and I'm sure many of you know this. It is a Labour policy. It's not necessarily a government kind of universally mandated concept. So this is something that was first talked about in Jeremy Corbyn's manifesto. And actually, if you want to have a look at the most deepest write-up about a National Care Service, it actually comes from Jeremy Corbyn's version of it, written back in 2017, but it was then reiterated and I would say massively slimmed down in Keir Starmer's 2024 manifesto, which took them through to number 10. So understandably, this part of the manifesto, now that they are in power, becomes part of a move towards policy, and we'll talk about what they're doing to move it towards policy. Just a bit of a recap of what it says in the manifesto. Again, I'm happy to maybe send out some links and you can read the thing in full in terms of what it says, but just a little description. This is directly from Keir Starmer and from the 2024 Labour manifesto. The sector talking about the care sector, needs deep reform. There are inconsistent standards, chronic staff shortages, and people are not always treated with care, dignity and respect they deserve. Labour will undertake a programme of reform to create a national care service. Notice they don't say might undertake, will undertake. Underpinned by national standards, delivering consistency of care across the country. Services will be locally delivered with a principle of home first. Really important point there. Home first. That supports people to live independently for as long as possible. Our new standards will ensure high quality care and ongoing sustainability and ensure providers behave responsibly. Labour will develop local partnership working between the NHS, social care on hospital discharge. So again, that kind of NHS social care partnerships kind of messaging coming through again. We will enhance partnership working across employers, trade unions, government, and establish a fair pay agreement. That's very much in the mix at the moment. We'll talk about the fair pay agreement shortly. This sector collective agreement will set fair pay, terms and conditions along with training standards. Labour will consult widely on the design of this agreement before beginning the process and learn from countries where they operate successfully. A great example of saying everything and nothing all at once. I don't say that as a criticism. I think they have purposely towed the line between this is what the fundamentals of a care service mean without giving details on exactly what that might look like. In short, it's about greater partnership between home care and the NHS, more of a home first approach, and the concept of a fair pay agreement. I mentioned that 2 weeks ago in the webinar. The government is working out a fair pay agreement that would kind of set national standards of pay for care that hopefully also work out financially. These are all building into this concept of a national care service. Now, what I'm about to jump into is some discussions around national versus privatised services. I want to make it abundantly clear. I in no way am against the fact that many in the care sector are profit making. I'm in no way against the fact that there is privatisation in the care sector. This is not me saying that this is a bad thing or a wrong thing. I'm simply going to highlight how that relationship between nationalised and privatised services causes challenges and causes a big discussion about what the National Care Service looks like. So as I go into this discussion, please know I'm not saying anything negative about the concept of a privatised adult social care that we have, or about the fact that many adult social care services are profit making. So if we think about education, as we know, education is government fully funded and government fully delivered. So if you go to your state primary school, the government pays the teachers, the government runs the schools, the government assesses the schools. It's all done. On incredibly rare occasions, we're talking probably less than 10, 20 in the country, there may be individuals sent to private schools, typically those with SEND and incredibly capable parents who have made the argument, where local authorities might pay for those individuals to go to private school. But that's in a very, very, very extreme situation. Private schools are a completely separate entity to education schools. They are in many ways self-funded, although we've had the whole VAT situation. People choose and pay to go to those private schools. They are not regulated by Ofsted in the same way. They are separate entities. That's how national and privatisation works in education. Healthcare, particularly NHS, gets a bit more complicated. Key tenet of the NHS is based on need, not ability to pay. NHS services are free of charge, except in limited circumstances. We have seen within healthcare around 5.2% of NHS-funded elective procedures were performed by the independent sector. But this was because of capacity issues. And again, patients will not have to pay those costs. I remember when I had some heart surgery back when I was about 19, they put me on a private ward bed, not because I paid for it, not because I deserved it, quote unquote, but because they didn't have enough beds, but I had this operation booked. So bless them, the dear old NHS probably paid 2 or 3 grand just for me to sleep in a bed in another ward within that same hospital that was the private ward. So there's a slightly murkier relationship, but all in all, almost all NHS care is delivered and funded by government. Then we get to the curious case of adult social care. And I know you all know this. I know that you are living this day by day. I'm not claiming to be some kind of prophet oracle teaching you stuff you don't know. I'm just trying to set the groundwork for why a national care service is going to be an incredibly complicated beast and an incredibly important thing for us as a sector to be a part of, to get ahead of, and to be very actively involved in the construction of. From the 80s onwards, some of us remember the 80s. I don't. I was 2 when the 80s ended. But from the 80s onwards, adult social care became significantly privatised. It wasn't quite overnight, but certainly through the 80s into the 90s, there was quite a movement towards privatisation of adult social care. I'm using the example of residential just because there's the clearest data available. At present, according to the Department of Social Policy and Intervention, University of Oxford, 96% of residential services are outsourced primarily to for-profit providers. I'm not saying that's a bad thing. I'm not saying that's wrong. I have no problem with that. I'm just giving you the number. So 96% of residential services are ran kind of primarily by for-profit providers. However, and this is where it gets murky, 65.1% of care home residents were actually state funded. And I know you know this. This is your day-to-day. This is your day-to-day headache. Your private funded versus your local authority. We know that this is an issue. But it becomes incredibly important when we start to think about what on earth does a national care service look like when 96% of residential services, for example, are privately owned. 65% of people in those homes are, however, being paid for by state funds. Just to give you a little analogy, if we took those residential numbers and put them into education, just imagine, just for a moment, I'm not saying this is right or wrong, I'm just trying to give you the mental language to process. Imagine if 96% of schools and school places in England were private schools. So imagine that almost every school, 9.6 out of 10 or 96 out of 100 schools in your region, 96 out of 100 were private schools, but 65.3% of the students that went to those private schools had their private school fees paid for by the state. I'm not saying that it's right or wrong. I'm not making a value judgment. I'm saying that you can see now why the government and public opinion is starting to move towards how can we, quote unquote, solve the care situation. So what? What does this mean? This matters because when we look at the way that social care is set up, and then we look towards the concept of a national care service, there are 4 key aspects that are going to potentially massively change if a national care service is developed and rolled out. The first fundamentally will be a different relationship between a person's means and their eligibility for care funding. At the moment, there's means tests. You know, there's things around people often people's property and the value of their property gets factored into their care fees and so on and so forth. That may, to some extent, change if we have a national care service. If you're using the language of the NHS, then you're going to assume that it's going to be focused more on need rather than means. Number two, a different relationship between central government, local authorities, and care providers. We'll talk about how some of those models might work. Number three, greater consensus around funding models and charge pay rates. A big challenge at the moment. It does feel like a postcode lottery, and we've had people that say they've got homes in multiple local authorities, and the rates they can get in one local authority are vastly different from the rates in another local authority. And so it would certainly be central that any kind of national care service would involve, to some extent, a nationalisation of the funding models, the pay rates, the charge rates for care in this country, which of course begs the question, what do we do about the fact that, for example, in residential, 96% are private companies? Number four, could it also include free at the point of use for all? Now, this is something that I think would be incredibly complicated, and we'll talk about how it might work, but imagine a world where when you need adult social care, whether that is home care or residential care, it is completely free for you. The government pays or funds that. That would be a massive shift in the way that care is prescribed, in the way that it's funded, in the way that it's accessed. It would also have huge implications for us as a sector in terms of how we deliver a care, what our expectations are, and so on and so forth. So if Sue's saying CQC, I nearly slipped it in there, didn't I? If the government are talking about a national care service in line with something like a national health service, we are talking about a significant change to the way that care is funded, the way that care is received, the way that care is organised. We'll go through some possible models in a moment. But let me just quickly tell you about what won't happen. I do not believe this will happen because it would simply be too costly. What will not happen is the government going, right, national care service, switch it on, free care for everyone. So just let forward on those invoices from your care homes, from your private home care agency. Just send them to Keir Starmer at number 10 Downing Street, and we'll just click pay and pay those. That's not going to happen. If you look at the NHS model, if you look at the education model, they fully fund it and they fully run it. And I think that's a bit of a way away too. I don't think that's going to happen either. But what I don't think is going to happen is the government just saying, you know what, we'll just let the private care companies continue to run and work. We'll let all care companies continue to run and work and just send the invoice to us instead. We'll pay for it. Local authorities or centralised government will just fund all care as is for all people all the time whenever they need it. That is simply not a sustainable model. It's simply not going to work, and it simply would not get off the ground. So what that means is that any move towards a national care service is going to involve a disruption in terms of how care providers and potentially local authorities and central government interact with one another, how they are funded with one another, and how that decision-making process goes. So I'm going to run through a couple of models that we see in other countries and that we see as a possible way of working. I do hope this is useful. I know it's a bit theoretical, but the reason why I'm kind of getting in front of this now is because we as a sector do need to get our heads together and be quite firmly represented with as close to a singular view as possible on what a national care service should look like. So let's look at the simplest version. This is what I call National Care Service Light. A simple, nationally agreed cost of care. I say simple. It's simple in the sense of it's not essentially creating new structures and management structures and services. It is quite simply, we are going to agree that the cost of care, if you are receiving residential care, this is the cost per hour, or this is the cost per person, per room, however that would be worked out. So that would be the first thing. A very simple version of a national care service would simply be nationally agreed costs of care for the different forms of care that people receive. This could then be centrally mandated from government, which would then spill into local authorities. So instead of local authorities being involved in, debate and conversation and strong arming and back and forth and negotiations, it would be a universally mandated set of costs that travel through, and local authorities then pay those costs. There may, of course, be some uplifts based on geographical areas, such as cities like London and so on and so forth. Obviously, there would be different rates based on things like residential care versus home care versus learning disability versus complex care. In short, National Care Service Light is basically a price menu. It could result in a mandate that self-funders pay similar or a cap above rates, because if the government says we are mandating that these are the rates of care, then it could mean that any self-funding pay is in some way either brought in line with or is given some form of percentage cap over that, and that's considered kind of a standard rate. Few benefits and challenges to this. First of all, benefits: you would eliminate the postcode lottery. There would be universality in terms of costs and pay rates. It could bring self-funders closer in line with local authority funded care. Obviously, this could raise some alarm bells for some providers in terms of depending on how their financial model balances private funded care versus local authority care. There would be much more transparency around care costs if they are kind of nationalised and centralised. If developed effectively, it could result in a more sustainable, better funded workforce. It also could result in a very, very, very stretched workforce, depending on what that amount is. If they were to do a national cost of care, it would obviously be directly informed by the Fair Pay Agreement, which is something that Labour is actively working on to define what should be considered fair pay within adult social care. Challenges, of course: how do we arrive at a cost? How do we decide that to stay in a residential care home in this area costs this per night? The end, full stop. How do we say that if you have a complex need, the rate of care and the rate of pay for staff is this? The end. The challenge is care is about people, and people come with all kinds of unique and wonderful things going on. And as a result, an arbitrary amount could become quite complicated, could become almost irrelevant. How universal can it be considering socio-economic factors, the factors in terms of people's private and personal care needs? Can the private sector be made to charge specific costs? So do we get to a model like the education model where you have state care, you have state education, and then you have private schools that can do what they want? Private schools, if they want to charge you 20 grand, 50 grand, 100 grand a year, that's up to them. They're their own animal. And then you've got primary schools, state primary schools that run separately. So would that cause a complete separation between private and so-called state care, which, by the way, doesn't really exist as much anymore? If not, could the private sector be forced to charge? I know they already are to some extent by local authorities, but we're talking about a universality across the entire country where there would be, this is the rate for care, the end. Will agreed cost of care actually result in good quality care being harder to deliver? How might exclusively self-funded services be affected? Will they essentially operate in a separate world, a little bit like private schools versus state schools? So that's one, just the price list version. Number two, centralised management of care contracts. Now, again, centralised could mean 100 things. It could mean getting rid of all local authority involvement. It could mean smaller local authority involvement. It could mean centralised decision making, with local authorities then enacting the decision that the centralised government decision has made. So I'm not talking, this could go in one of many directions. But if we get to a point where we have nationally agreed costs of care, if we have agreements in terms of what pay and care is, and that's done on a national level, what does the role of local authorities become? Are they completely moved to one side? And actually, we are dealing directly with, the Office for Social Care Provision or some other centralised office that manages all care contracts? Is it that local authorities essentially do the outworkings of those contracts but are no longer involved in negotiating? They're no longer involved in running. Perhaps they may not even be involved in monitoring that care in the same way that they currently are. Scotland's National Care Service had some versions of this where there was kind of centrally mandated modes of care and costs and pricing, and then kind of local regions were involved in kind of outworking that. Scotland's National Care Service was essentially abandoned as a policy in January 2025. It didn't seem to really get cross-party agreement. So could we see that a centralisation, a National Care Service that centralises the decision-making, the funding decisions around care, does that result in either a reduction in the role of local authorities, the complete removal of the role of local authorities, or the local authorities essentially being involved in the day-to-day outworkings rather than being a central part of the process. Potential benefits to this: it could generate huge savings for local authorities and nationally in terms of budget and personnel if local authorities are no longer as actively involved in the space. It could remove the local authority postcode lottery because, again, at the moment, the rates you pay are really dependent on, if you're providing state care, are really dependent on who the person on the end of that local authority phone is and how good they are at wangling prices and so on and so forth. It could result in better transparency and better kind of national data around care costs if things are centralised. Challenges: it could result in longer, more complex processes because, again, if you're having to go to a central government department, that means there's a huge load on that government department as opposed to it being spread across multiple regional local authorities. It could make moving out of or between care more complex because you might not have that same kind of local connection that you have with a local authority. People may be asked to move further away if care is no longer considered a local authority provision. I would highlight Keir Starmer's point, and the manifesto did highlight this need for local community care. So that would be a bit of a shoot in your own foot if you did do that. So I'm sure any way that local authorities do or don't change in their role, there would still be some mechanism to retain that localized aspect. So it'd be interesting to see what that could look like. And again, it might go against that national care service concept of keeping care within the community. So if we did move to something that heavily reduced the role of local authorities and moved to more centralized management of care and care budgets and the decision making around care, would need to be ensured that there is still some kind of local collection. Now, version 3, and again, it could go into multiple directions. Version 3 is what I call the most extreme. This is hardcore NHS, but as care. This would be where we get to a point, and I don't think it's going to happen, certainly not in this decade. Could we get to a point where care providers are actually partially or completely run nationally? Much like my school down the road, my local primary school, Downs Primary School, pick up the Downs, that's the one I went to when I was a kid. That school was fully funded by the government. All the teachers were paid by government. You know, I assume the government in some way owned the building of the school. It was a government state school. Every penny that went in and out of that school came from the government, was owned by the government via taxation. That is what 99% of primary schools are. It is possible. Could we get to a care sector that moves towards this? I think that would be incredibly complicated for residential services, for the simple reason that residential services would either need to be purchased, built or maintained. At the moment, as we saw in that stat earlier, 96% of residential services specifically are currently owned by the private sector. So I don't quite see how on earth the government could create their own nationally run care homes. And actually, if we look at the NHS and so on and so forth, I don't think that's really what people want. However, when you look at Keir Starmer's language about home first, and when you think about the nature of home care, which doesn't necessarily require physical buildings, physical properties, it essentially needs organisational infrastructure, so offices, management teams, and it needs staff. There is a possibility that the government could work towards some form of nationally run, nationally funded, government organised, centralised home care service. Maybe it would just be in between respite. And again, whether this is possible and whether this could happen is very different from whether it will happen. The point I'm trying to highlight is there are these gradations of what a national care service is. Could it just be a list of prices? Could it be a centralised managed process, which means that local authorities are in a different space and the relationship between care providers and government changes? Could it be that the government sets up their own working forms of care, much like schools, much like hospitals, that are fully funded, fully run by, fully financed by taxation, government, state? I think it'll be incredibly difficult to do that for residential services. It is possible that home care could be an example where that could be attempted, because you're talking about staff and organisational infrastructure. You're not talking about huge buildings, huge properties, huge new builds, etc. What would this mean? Well, potential benefits in terms of facilitating the partnership between NHS and social care. At the moment, the NHS has to deal with thousands of us. You know, we're all our own little islands, we're all our own little worlds, we're all our own little care homes, home care agencies, learning disability, and the NHS has to kind of have its fingers in literally hundreds of thousands of pies if they are to integrate, quote unquote, with us as adult social care. I know local authorities can be a good middle point between them and so on and so forth. I'm not saying it's impossible, but it's hard. If there was a nationally run, either partially or fully, set of care services, whether they be residential, whether they be home care, you could see how that relationship between the NHS and those nationally run care services could be smoother than all the independent, privately ran groups by different people. Potentially greater consistency in terms of quality care, delivery of care, if it truly is a national care service set to national standards ran by the same central group. If you look at something like primary schools, whilst I know every school is different, every teacher is different, etc., 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 if you go to 2 or 3 different primary schools, whilst you might get various differences, they are teaching the same curriculum. The teachers have all gone through the same training. They'd have, by and large, the same school structures, etc., etc., etc. I'm not saying that's a good thing, but it is something that we probably don't have across our sector in the same way. Could it be a better spend of taxpayers' money? I'm not saying it is or it isn't, but that would be part of the argument. Would it be a better spend of taxpayers' money to have a nationally run care service? It would certainly be easier to facilitate the free up point of use model if the central government both funds and delivers care. Again, home care is potentially a possibility. I think residential care would be a bit more complicated. Challenges: this would be a significant undertaking. We're talking about a complete transformation of an entire sector and really walking it back 40 plus years to the 80s. Secondly, we have a much larger aging population, a much larger learning disability and special needs and mental health population. So this would be a significant undertaking to in any way reconstitute these care processes under a national care service. Significant questions around the role of private providers. Are we part of the game? Are we part of the delivery? Are we suddenly kind of given this kind of public enemy number one? Oh, we don't want these private companies running our care homes anymore. We want to take it back and run it nationally, much like discussions have been had around electricity, around gas, around the rail service. Would we suddenly, quote unquote, become the quote unquote bad guys as a predominantly private set of institutions? Finally, would this model actually deliver savings for taxpayers? Would it actually create closer connections between NHS and social care? It sounds like it would in principle, but there's no guarantee that it would work. Few little very quick last bits. Number one, don't panic. This isn't all going to happen overnight, and it might not even happen at all, because this is a Labour policy. So Labour's manifesto leans towards this. So any change in government could result in changes again. Phase one, they're in the middle of a medium-term plan, which is essentially looking at the current processes, the current spend, the current NHS funding, current local authority for adult social care funding, the interface between health and social care, and seeking, is it being best used, identifying what changes need to be made. So essentially they are doing a review at the moment, which will be completed at the end of next year. 2028 is when things start to kick off. This should build on the Commission's medium-term recommendations to look at the model of care needed to address demographic change, how services must be organised to deliver this, and discuss alternative models that could be considered in future to deliver a fair and affordable care system. In short, it is in 2028 they start to think about what could change look like, how could we make this happen. And the reason why I'm saying this today is I think as a sector, we need to have as close to a singular voice as possible in this. This is a really important discussion that we need to be a part of. We need to ensure that the needs of people receiving care are absolutely paramount. This doesn't become a cost-saving exercise, and we need to be taken along the journey as potential significant organisational changes between the government, local authorities, care providers, people receiving care potentially start to take shape. Quick summary: Labour is actively exploring the development of a national care service. It will fundamentally change the relationship between national government, local government, care providers and people receiving care. Lots of potential models. Fundamentally, the relationship between privately run care providers and government funding could change significantly. We have about 3 years of discussion before things start to get fully explored. And as a care sector, we must be central to that conversation. Next Wednesday webinar is in 2 weeks, and we're going to do it as a Q&A. Keep an eye out. I'm going to send some links that people can kind of submit their questions. It's going to be a Q&A around CQC, Single Assessment Framework, and other things as well. That will be on the Wednesday, the 23rd of July, between 12:30 and 1. Before you go, if you have any training needs, we have our Care Staff Confidence Training. We can help you with your care staff to speak with CQC and have those conversations and kind of put their best foot forward. We also have our Get CQC Ready training for leaders and managers to help them get ready and get your business kind of ready for CQC inspection. And of course, we have our lovely Care Surveys platform and our Care Surveys feedback surveys. 3 out of 5 evidence categories are feedback. We can give you really great independently ran feedback surveys and documents, so you have all the feedback you need, and you're not having to tear your hair out screaming at SurveyMonkey. There you go, at 2 a.m. So very happy to help with any of the training for care staff managers or with our feedback surveys. Do feel free to get in touch if you've got any questions, if you want to raise anything, if you want to discuss anything either around what we've discussed today or around the training for care staff, the training for leaders, or around our CQC feedback surveys as well. Feel free if you want to scan this code to get in touch. Again, you can always email research@careresearch.co.uk. You can find us on LinkedIn. You can go to our website, careresearch.co.uk. We will be putting this video up on to YouTube as well, and we'll let you know when that is there.